welcome to Life Addictions, the Prevention and Recovery Show. My name is John Lausch. I'm a certified recovery specialist here in the state of Florida. And every week we bring you a new show with a new topic, all talking about addiction and recovery. We talk about drugs and alcohol and how people are addicted to that and the new recovery models that are out there. We talk about food and nicotine addiction. We brought you a specialist talking about how to stop smoking and some of those modalities. Last week we talked about sex and love addiction, and we had a sex therapist, Robert Siegel, on talking about how to recover from sex and love addiction. Today we have a very special guest to continue our great guest lineup in our shows, Laura Hughes. Laura Hughes is a licensed mental health counselor, and she's in private practice. Laura has spent 15 years in the adolescent treatment in various rehab centers, and today she's working on her own and helping her clients, mostly those in the adolescent area, helping their parents and the kids recover from drugs and alcohol and whatever traumas they have. Welcome, Laura, to our show. How are you?
I'm great, John. Thanks.
Please introduce yourself to our audience and tell us a little bit about what it is you do.
I really enjoy working with families because if you identify the child as the problem and the whole family unit doesn't get the help, it's likely to fail. The family, sometimes the addiction really is with the parents, with the child becomes their addiction and fixing them. So everyone has to own their own part and grow together as a unit and learn new and better ways to interact with each other to really be a success.
You know, this whole adolescent field, it really is a specialty, isn't it? Because you have the dynamics of a young person just coming into their own,
right,
having these certain liberties that they're now used to, and then you have the parents that are sometimes controlling and they want to do certain things their way. Tell us a little bit about how that dynamics really work against each other sometimes in this field.
It's contradictory because you have a child. 12 years old is real common for kids to begin in their addictive cycle because it's the point where they're turning into a teenager and they're supposed to be rebelling, they're supposed to be finding their own life, they're supposed to be figuring out who their life mate is and what are they going to do for a career. And it's then the parents start drugs and the parents want to control them, and then you really have a rebellious sort of a setup. John Bradshaw, that talks about family systems, says that when kids become teenagers, the parents need to get fired as managers and hired back as consultants.
That's a very corporate approach to raising a child, isn't it?
Right. And yet when the child is before 12, they need the management. They need to be told who their friends are going to be and what's appropriate to wear and sit down and study your schoolwork. They need a lot of structure. And if that job has been done, then it's a natural transition that when they go in the teenage years that they can start running their own life according to what they've already been taught.
So you not only got to counsel the child,
yes,
you've also got to meet, I'm guessing, a lot with the parents and
yes,
and meet with them and counsel with them as well, right?
Right. Probably the most difficult parents to deal with are parents that have been actively using in their life when their kids were small.
Yeah.
They feel very guilty that they are the ones that taught their children how to be addicts, and therefore they release the child of responsibility by blaming themselves. So they'll say, the kid will throw out when they're a teenager, well, it's your fault. You used to drink da-da-da-da-da, and the parents say, oh yeah, it is my fault.
Right.
But what they really need to do is, yes, this is what I did, and I did what I needed to clean my life up. But you are doing what you're doing, and you need to clean your life up when you're ready to do that, and not take responsibility for what happened to them. You know, there are a lot of people that have stuff happen to them that don't become addicts.
Yeah, you're right. Today, more and more parents have been addicts or have been in some kind of recovery, and now they've have children that. And younger these kids are with all these new drugs that they're prescribed for ADD, ADHD.
Right, and they abuse them.
Yeah. It's huge. And it's getting younger. You said 12.
Yeah.
That's when they start, isn't it?
A lot of times, yeah.
Yeah.
Around the age of 12.
We're going to be back, and when we come back, we're going to talk about how or what is the latest trends that Laura Hughes sees in the recovery field, in the adolescent treatment of these young people out there. And we're going to watch a 1-minute commercial. We'll be right back. Life Addictions, the recovery program, has been under development for over 3 years. It's personal, portable, and more importantly, it works. My motivation to start this business was to help people with addictions, to literally help save lives.
We're best known for our delivery system. It's called the Recovery Pod, embedded with life-saving audio. Just open it up, turn it on, and hit play.
Along with your Recovery Pod, you get a 4-page laminated follow-along guide. What sets us apart from our competition is our message. It's uplifting, inspiring, and to the point.
My name is John Laus, the creator and developer of Life Addictions, the recovery program. Our model of recovery starts with clarity. Clarity from the minute you wake up and open your eyes. Knowledge and know-how. Know-how are the things that motivate a person to change and take action, like your health, your family, a life that works, and a life with a purpose. Life Addictions, the recovery program. Visit us at our website at lifeaddictions.com. Hi, and welcome back to Life Addictions, the Prevention and Recovery Show. Our special guest today is Laura Hughes, who's a licensed mental health counselor, and she specializes in adolescent treatment and recovery of drugs and alcohol, the young people out there in our society that succumb to addiction. And Laura, talk to us a little bit about what do you see out there as being some of the new trends as far as addiction goes?
A couple things have happened over the years, opposed to when I grew up in the 60s. Like heroin was an absolute no-no. I was not that bad of an addict that I would shoot up heroin, and it was very dangerous. But so many of the drugs have become much more pure and safe in an odd sense that it's not uncommon for heroin to be a popular drug, or the oxycodone or Roxys that are prescribed by doctors. There's a real conflict between the medical field and addiction, and not a lot of doctors know about addiction. They see it's their job to prevent and relieve pain. So if a child goes and has their wisdom teeth out, they're going to be prescribed Oxycontin or something that's close to that, oxycodone or something close to that, not realizing that they're actually feeding into the whole addiction cycle.
And you know, these new prescription drugs like Oxys, they really are just the synthetic version of heroin.
Right.
So when you mention heroin back when you were in your day, or back in the even 70s and 80s, and now it's more Oxycontin.
Yeah, exactly. And even there were methadone clinics, that it's just the same version of the same drug that has the illusion. I'm sorry, my brain just had a lapse.
So, a lot of times we talk about these new prescription drugs, and we've talked about it many times on this show, and how it's becoming, not only that, but like bath salt is being used now.
Right.
And there's so many different ways for young people to get high, not even to talk about glue and household chemicals, but these prescription drugs that, and a lot of times, I always say that they're wonder drugs. They really are. Used properly, they're very wonderful drugs. But like anything, as human beings, we, abuse them and become addicts.
The major problem underneath the use of drugs is that thinking gets twisted. I remember one girl saying that she was doing acid with her boyfriend at a construction site, and his twin brother was with him. And the twin brother flew off of thought he could fly and flew into a pit and died.
Yeah.
Well, a normal person would say, oh my gosh, we need to stop doing acid. This is not safe. Puts our life in danger. But their decision was, well, let's get a motel room on the first floor and lock all the doors.
Yeah.
So we can continue doing this. Even down to the simple thing like drinking and driving, that I just got a DUI and I went to prison. Well, what's the solution? I need to be more careful.
Yeah.
The solution doesn't become, I need to quit.
Right. That's interesting you say that, because there's always gonna be something out there, and there always has been. What is the difference between a person, and I often say that it's an underlying cause. Like somebody can say, I don't like the way this makes me feel, therefore I'm not gonna take it anymore. And then there's other people that say, I love the way this makes me feel.
Right.
What is the difference between the underlying causes of these two people? What in their lives has happened? What are they trying to escape? What are some of those underlying causes that you see?
The largest problematic part of the whole addiction that I see is this lack of the ability to cope with your own life.
Yeah.
That things have not been taught that the child needs to have, because parents overprotect. The children look for their solution to the parents. Oh, I want that new bike, but I don't know how to go out and mow lawns to earn money, so I'll manipulate mom and dad into getting it.
Right.
So the parents become the solution, and if the parents enjoy being the solution, then you have a very sick symbiotic relationship.
Yeah.
So the inability to cope with your life is probably one of the main reasons that adolescents start using drugs to belong, to fit in.
Right.
Out of those 100 kids that use, really only about 10 to 15% actually become addicted, because they are medically predisposed to, just like people that smoke cigarettes, not everybody's going to have cancer.
Yeah.
But if you are predisposed to that, then you will, and smoking will increase that. So some people's brains are wired that way. That's what the medical model says. It's a disease.
We have Laura Hughes with us, licensed mental health counselor. Laura, tell us a little bit about, because we've been approached here at Life Addictions Recovery Show to come up with a prevention model, not relapse prevention, but a prevention model for schools here in the Palm Beach County area. And the statistics are staggering. How many kids use in the Palm Beach County area drugs and alcohol. And so we were approached to come up with a program. What do you think about this prevention model for, say, young people that are 12 and under? What are some of the pinpointing effects that you see? You've been a professional in this field. A child, a family that hasn't quite yet experienced addiction. What are some of those, if you can think of one or two or three pinpointing things you can point out to help somebody prevent themselves or their family members from going down that road?
Start making your children responsible for their own life as early as possible. It comes out of codependence, part of the problem. And when your child whenever they're able to take care of themselves, let them. When they can change their own clothes, don't change them for them. When they need to get to school, let them ride the bus. Let them be as independent as they are capable being for the age that they're in, and recognize that being a good parent is letting your child become self-sufficient, not making them dependent on you. It's a natural teenager's job to rebel. And so don't give them so much to rebel about, and give them lots of guidance and skills for managing their life. Let them know that life isn't fair, but there are things that you can, how to deal with things when they go wrong. And also to know that life is so unfair, sometimes it's fair in our advantage, and to appreciate all of that. Let them know they're valuable. Let them know that their opinion matters. They're really smart.
They really are. I mean, today kids in our society
Yeah.
are so much, I mean, they've got technology, they've got so many, guidance counselors.
Yeah.
They've got so many things out there today that they really, adults try to look out for them as much as they can. You've got this horrible news from Penn State, but even that has brought to the limelight, that horrible abuse that kids are enduring today. And especially with drugs and alcohol, there's so many programs out there that are available, but it seems somehow to be never enough.
When my son was at that age in 15, 16, he said to me, Mom, well, the problem with you is, and I always love those talks, here it comes, and he said, the problem with you is that you won't let me have hindsight. And I have to have hindsight before I can get insight.
Right.
How can I manage my life if I don't learn to deal with the mistakes I make and grow and learn from them? And I looked at him and I realized that I was always trying to prevent him from getting in trouble.
Yeah.
I never let life just come at him as a natural consequence and then be a guide, a consultant, so that he could work through it.
Isn't that what they always say, though? The parents always say, learn from my mistakes.
Yeah.
I've been there. Don't repeat what I did.
How can they do that?
Yeah. Some kids like to learn their own mistakes, but then there's other kids, let's face it, that say, and they're, I don't know if they're smarter or not, but they say, okay, I don't want to, that pain or agony that you went through.
Yeah.
And in many ways, I would say they would be a little smarter in that aspect, where they don't want to experience that trauma or that pain that a parent's trying to express to them that might happen going down this road. But as human beings, I guess we all have to experience a little bit about those growing pains.
That's what we grow from, exactly.
Yeah. There really are two schools of thought. I mean, either listen to your parents and, and have a little less pain and be a little more successful in life, or have your own experience. And sometimes addiction lasts 5, 10, 15, 30, 40 years. There's
a couple of things that come to mind about that. Bob Dylan said once that we parents try to give our children what we lack to get, instead of considering what the child needed. There's a gentleman out of Waco, Texas, named Dr. Massey, and he talks about that eloquently, about my grandparents came out of a Great Depression. So what became important to them was that their children had food and shelter. Now, my grandparents having food and shelter, what became important to them is that they have prestige. Now, with my father, when he was mayor, he was, 50-year fireman and did all of these things in the community. And what became important to me was having time with me, which I didn't get. So I gave to my children being their best friend and being with them all the time, and what they didn't get was a sense of responsibility for their own life. So trying to give your child what you lacked as a child isn't what they need. What we need.
We're having a great conversation. We're here with Laura Hughes, and when we come back, we're going to take another small break, and you're going to watch a commercial about the Recovery Pod. And Laura, I want to ask you about that when we come back, and a couple other things, especially how you get adolescents. They all have to go through their rituals and, those kind of things. Rite of passage in certain ways with alcohol and doing a little bit of partying. But how do you get them not to be addicted, or what do you say to them? It's okay to have one or two. What do you say to them? When we come back, we're going to talk about that. We'll be back in a minute. Imagine a world without addictions.
I lost my father.
I lost my best friend.
Today, the addiction rate in the country has reached epidemic proportions. It seemed that only a miracle could stop addictions. But instead of a miracle, we are given the Recovery Pod.
Within a short period of time, a person listening to the Recovery Pod can make a shift out of addiction.
I was addicted to alcohol.
I was addicted to Oxycontin.
I was addicted.
The Recovery Pod can effectively reduce addiction in our nation. It is for individuals, institutions, rehabilitation centers, insurance providers, and federal, state, and local governmental agencies.
After years in recovery, it still works for me. And now, the Recovery Pod can work for you.
We need to make absolutely certain that every American with an addiction problem can have access to the Recovery Pod as part of their treatment.
Because freedom isn't free if you're addicted. The Recovery Pod. Get it now.
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 The Recovery Pod. Get it now. Hi, and welcome back. And you just saw our other commercial with the Recovery Pod. It's, as you see, it's an audio recovery program that's already downloaded onto an MP3 player. Now, Laura, you've seen this product. As a matter of fact, your significant other, John Wolf, has 3 wonderful tracks on here.
Excellent product.
Yeah, it really is, isn't it?
Yes.
What do you think about a product that uses some of the laws of learning, like the law of repetition? Somebody, hear over and over again.
Repetition, affirmations, the meditation that you spoke of are all effective means of providing information to the conscious and subconscious mind.
Yeah.
Very important. And that goes along with the question you're asking, what can parents do? Be that program to your children and teach them. And when a kid says, is drugs okay? No, it's not.
Yeah.
Be really clear.
Right.
It's I liken it to a corral of horses and a storm's coming, and the horses are all getting jittery and whatever. You can't control the horses, but you can build a really strong fence.
Yeah.
And that's what I recommend to parents.
So when a child says to their parents, well, you did it, so what's a parent to say? Well, it wasn't right when I did it either, so
that's right. It was a mistake.
Yeah.
And now I've learned, and it is not okay.
Yeah.
What's really okay is you becoming yourself.
Right.
And using, there are things that you can do to actually get out of the midbrain where addiction is rampant, and get to the higher regions of the brain and connecting with what we call a higher power. So it's like athletics, it's praying, it's meditating, it's journaling, it's reading good materials, it's having good discussions about what's important to kids and listening.
Let me ask you something. What do you say to a child? I alluded to this at the end of our last break. This rite of passage, graduation from high school or a celebration where everybody goes out, and it's traditional that, even though they're underage and all of it, just so everybody knows, I don't advocate any of this, but the reality is, that they have this, cake party or whatever. I've done it. They still do it today. It's inevitable in many respects. What do you say to that child or those parents? Or, do you say enjoy yourself but don't overdo it? What are some of those things?
I think the problem is the rite of passage needs to be much earlier, like 12 years old. We try to control the kid, and then they get this freedom of going to college and away from the family controls, not thinking for yourself. All of a sudden I'm managing my own life and I don't have the tools to do it with.
Right.
So I lack the ability to make good decisions or to learn there are consequences of my decisions because I've been protected against them. Start early. To put it into a metaphor, if I have a young child, a couple years old, and they see $1 on the neighbor's counter and they go sneak it and put it in their pocket, and your reaction, oh, isn't that cute? Isn't that sweet? And then you're down at the 7-Eleven when they're 5 or 6 years along, they're putting candy in their pocket. It's like, no, you shouldn't do that. And then the parent takes the money out to pay for it.
Right.
Or then you go on to 16 and they're stealing money from a parent's drawer or something. And then it starts getting more serious until you have a 21-year-old that's stealing from the payroll of a company. Now we got jail looking at us. Oh my God, I can't let my child go to jail. Well, guess what? You should have been taken care of when they were 1-year-old with $1 off the counter.
Right.
And teach them that's not correct behavior.
It really is a very complicated, and there's so many different aspects, and there's so many different demographics and how a person's raised and parenting skills and all that. And it really is unlucky for a person to get into an addictive pattern of behavior. It happens so often, and it's happened more and more often. Laura, I want to thank you for coming on our show.
My pleasure.
Giving us some insight on all of your experience. Now, you do private practice. Do you want to give out a phone number so maybe somebody that's watching they have a child or a family member?
I'd be glad to give out my email address.
Yes.
Which is Laura L. Hughes, LauraLHughes @Comcast.net.
Excellent. Laura, thank you so much for coming in.
My pleasure. Thank you for the service you're providing.
Thank you, Laura. And thank you, and we'll see you again next week.